In this section, in this little bit of lecture, I'm going to provide some information on food allergies. I'm going to start by going through a few definitions related to food allergies and a little bit about the immune system and how food allergies fit within that. So on this screen, we have some definitions. So kind of the broad umbrella category is food sensitivity or adverse reaction to food. So when we think about food allergies, we kind of use that term, but in reality, there are often food sensitivities which aren't a true allergy. So we'll look a little bit about the difference between the two. So basically, again, food sensitivities is the broad definition, of which one is food allergy and another is food intolerance. So we have allergies on the left and intolerance over here on the right. So really the key difference between a food allergy and a food intolerance is that an allergy causes some sort of immune response. So the immune system reacts in some way. So you see the breakdown here, there's different types of immune cells that can respond. So there's the IgE mediated, non-IgE mediated, or cell mediated, or mixed IgE and non-IgE. Just it's important to be sort of familiar with that terminology, but basically it's just a matter of different immune cells that react to the allergen. On the side of food intolerance, basically we have a non-immune mediated reaction. So what that means is the person's going to have some sort of physical symptom, but it doesn't involve the immune system. So that could be something like a little bit of GI upset or bloating, something like that, that it's not that the symptoms aren't real or that they aren't important, but it's not related to the immune system. So that's really the key difference to remember between food allergy and food intolerance is that food allergy involves the immune system in some way and intolerance does not. So as we talk about allergies and intolerances, particularly allergies, I think it's helpful to review a little bit about the immune system. So remember, lymphocytes or white blood cells are really a key player in the immune response. So the primary groups of white blood cells are T cells and B cells. So you often hear about those different types of cells when you're talking about the immune system. So T cells sort of look at everything that comes into the body and really distinguishes between three broad categories. So the T cells look and decide whether they think something is foreign, so from outside of the body, it's foreign but it's friendly, so it's not going to cause harm, or it's self. So those are basically the three primary categories. So things that would be foreign would be like viruses, bacteria, toxins, and basically any of those are an antigen. So an antigen is anything that our body recognizes, our immune system recognizes as being foreign and potentially harmful. And that's going to stimulate an immune response. The second category is something that the body recognizes as foreign, so it knows it's not part of the body, but it's friendly. So food would be an example of this. We don't want our body to elicit an immune response to food. So normally that works well. And then what it recognizes as self is the body's own cells. And so when there's dysfunction in this area, we have what's called autoimmune disorders, which you all have heard that term, but essentially it's that the immune system is recognizing the self as foreign. So again, in terms of terminology, antigen is a term to remember, and essentially it's anything that the body is recognizing as foreign and stimulating an immune response against. Now, hopefully in normal situations, those actually are things that could be harmful to our body, and so it's great to elicit an immune response. But we'll talk about food allergies a little bit when that kicks in at a time when we don't really want it to. So let's start by looking at how our immune system works in a non-allergic person. So basically we're saying if someone does not have any food allergies, what's kind of the normal response? So on the left side, I have that response to foreign. So essentially looking over here, we see that when our T cells recognize an antigen, so recognize something as foreign, and again, remember that could be a bacteria, a virus, a toxin, something like that, it will release cytokines. Those cytokines, lots of examples, but interleukin 2, INF gamma, a variety of cytokines that can be released. And then that stimulates the B cells to produce antibodies against that foreign substance. And the result of what the person feels is they experience symptoms of illness. So things like fever, muscle aches, and fatigue. So that's sort of, I guess, more tangible, the symptoms that we have that tell us something's happening in our immune system. And I think we would all recognize that from when we've been sick, if you have the flu or if you have a cold. Basically, this is what's happening. And so you have those feelings. So, in terms of response to food, in someone who does not have any food allergies, on the first exposure to the food, so the first time someone eats a particular food, the T cells recognize that food as foreign, so it's not part of the body, but something that's friendly. They produce what's called the memory T cells, and those are sent out into circulation. So then essentially the next time that the person eats that food, so the next exposure, the immune system immediately recognizes that food as safe, and we develop what's called tolerance to the food. So generally this happens early in life when we're exposed to a variety of foods and the compounds within that food. So that would be very normal. We develop that tolerance to food. Our body recognizes it every time we eat it as something that is safe. So now we can look at what happens when someone has a food allergy, so that immune response in an allergic person. On the left, I have that normal response that we just already talked about in terms of how the immune system works. But so that's just what we already saw. Let's shift over to this food allergy side. So again, when someone has a food allergy, their T cells are going to recognize that food as foreign instead of friendly. So that's called an allergen. The food is an allergen because it's causing the body to recognize it as foreign and not friendly. So the body then releases some different cytokines, still cytokines, but different ones that tend to be released in response to an allergen. Stimulates B cells to produce different antibodies. So here's where those IgG and IgE antibodies come into play that we saw earlier when we were talking about definitions, and we talked about like IgE mediated immune response, etc. So that's basically dependent on what type of antibody is produced by the allergen. And then the person experiences those symptoms that we know are affiliated with food allergies. So it could be swelling, it could be itching, sometimes itching in the mouth, it could be hives, a variety of those symptoms. And basically then this results in what we call sensitization to the food. So the next time that that person eats that food that they're allergic to, these same types of symptoms will happen. The body will recognize it as foreign. It will produce those antibodies, the IgG or IgE or whatever antibodies, and those symptoms will reoccur. So again, this is what happens in a person who has food allergies. So then the question kind of becomes what causes these food allergies, or what's the etiology? We don't absolutely know 100%, but there are some things that seem to contribute. There seems to be a genetic predisposition that people who have allergies tend to have family members who have allergies as well. Not always 100% for sure, but there does seem to be some genetic predisposition. There is some thought that increased gut permeability can cause or contribute to allergies. So basically, that increased gut permeability is when the cells of the intestinal tract aren't as tight together as they should be. So normally our intestinal cells sit right beside each other very tight so that when we eat food and it goes into our GI tract, it gets processed, it gets metabolized, broken down, and then it doesn't go out into the bloodstream until it has been metabolized. When there's increased gut permeability, then those junctions between the cells of the intestinal tract sometimes have gaps in between them, small gaps. And so then food components that aren't completely metabolized, for example, small proteins, leak through and get into the blood before they're completely broken down. Well, the body isn't programmed to recognize that as something friendly. It recognizes it as something foreign because it's not the form that it really should be in the blood. It should be further broken down. So there's some thoughts that that increased gut permeability could contribute to food allergies. Dysbiosis is the basically imbalance of appropriate types of bacteria in our gastrointestinal tract. So it's too much bad bacteria, too little good bacteria, and this is thought to perhaps contribute somewhat to food allergies. Medications can contribute to food allergies, perhaps, and then I have a bunch of question marks at the end because I think this is an area that really is continuing to be researched. We really don't know what is causing food allergies. There's like the hygiene hypothesis that says maybe we're just too clean and we don't let our bodies sort of get used to being exposed to a variety of things. A lot of different ideas in terms of what might be causing the rapid increase in food allergies that we've been seeing, but these are some of the possible contributing factors. In terms of diagnosing food allergies, I think the biggest thing I want you to remember with diagnosis, I mean, to be familiar with some of the things, but realize that the tests we have are not extremely fantastic, honestly. They help to some extent. I mean, they do help, but they aren't absolute. So really the tests that we have need to be combined with patient history and symptoms to really see what's going on. So skin tests at the top of the list, so like a skin prick or scratch test are commonly used. And essentially it's, making a scratch or a prick in the skin, opening the skin, and then exposing it to potential allergens to see if there's a reaction. I think one challenge here, we all realize that we don't put food through our skin. And so it gives kind of a general idea if our body's going to react, but things function a little bit differently when they go in the GI tract versus when they go in a different route. So that's one. Detection of antibodies against the food. So basically this is using different lab procedures to see if there are antibodies in this person against the food, which would tell us that they had produced an allergic reaction in the past, had produced those antibodies. But just because someone has the antibodies doesn't absolutely mean that they have symptoms related to food allergy. So none are extremely accurate, particularly for positive results, meaning that if someone has a positive result on one of these tests, it kind of is a first line saying, maybe there is a food reaction, there seems to be some sort of reaction, but then again, you really need to combine that, or the practitioner who's doing the diagnosis needs to combine that with the patient's history and symptoms. So as a dietitian, one thing I think is important to recognize from this is that if a patient comes to you and says, I had a skin test or I had an antibody test and it came out positive for this whole slew of foods, it does not necessarily mean all of those foods are going to have to be eliminated. Then it's kind of trialing through to see what sorts of things they have reactions to. On the next slide, I have a little video link to YouTube that I think has a nice a description of the skin test procedure, since that's a very common one. I'd like you to look through that so you have sort of an understanding of what that procedure involves. This is the link to the skin test procedure. So if you can just copy that link into another browser and watch that video and then come back to the presentation, that would be great. Another method for diagnosing or helping diagnose food allergies are elimination diets. So essentially elimination diets are doing exactly what the name says. They're eliminating some foods to try and figure out what is causing the symptoms. So elimination diets can really vary in the extent that the foods are eliminated. A lot of the choice related to how extreme the elimination diet is relates to how extreme the food allergies are and how extensive it's thought that the food allergies are. So a selective elimination diet would be just that a relatively small number of foods are eliminated. You would use this if the person doesn't have real extreme symptoms, doesn't have them all the time, but you sort of seem to have a sense of a number of foods, maybe 5 or 10 foods that they think might be causing the problem. So then you just eliminate those foods. A few foods elimination diet is more extreme, where you're going to eliminate a lot of foods and only eat a few foods. So this would be where there's really extensive allergies, or they think that they're allergic to a lot of foods. And so really a lot need to be eliminated, and they need to stay with only eating a few foods for a while. And then elemental diets are for extremely severe allergies, where it's thought that the person really is allergic to many, many things, and you have to get down to very basic broken down nutrients essentially, and then gradually add back foods. So basically, in an elimination diet, some foods are eliminated, maybe a lot, maybe a few, just depending on the severity. And then it's followed by a food challenge. So basically, that is adding back foods individually and monitoring for a reaction. So this can be used for both food allergies or sensitivities. So it works well also, just with food sensitivities. So it may not be stimulating an immune response for a food allergy, but certainly the symptoms can still be very real in food sensitivities. So it's still really important to be able to help patients figure out what's causing it so they can eliminate that from the diet. I think this is an area that is really important to be familiar with. Not everybody uses them, but it's non-invasive, and it's very real. It's very tied to that individual person's symptoms in terms of how their body actually reacts to the foods when they eat them in a normal diet. And I think that's really important to consider. On the next screen, I have, again, another short YouTube video for you to watch that I think is interesting in terms of the potential of using an elimination diet. Again, if you can copy and paste or type the link into another browser and watch this video, this is a dietitian from Australia, her experience with using elimination diets. Again, something to keep in mind and sort of have in your toolbox, so to speak, as you work with patients who are having symptoms, and maybe it's something that they can't figure out, and even when they've worked with healthcare providers, they really can't figure out what's causing it or what's going on. Maybe allergy testing came back that nothing was wrong, but they clearly have some symptoms. So this sometimes can be helpful. So if you take a minute or a few minutes to watch this video, and then continue on with the presentation. So in terms of medical nutrition therapy, what do we do for patients with food allergies? Well, the bottom line is we need to eliminate the allergen, or whatever they're sensitive to. And of course, that's easier said than done sometimes, depending on what the allergen is, how much it's in food. As we all know, if someone's allergic to something like eggs that's in a lot of foods, or wheat, or things like that, it can be challenging. So a lot of it is really supporting the person, providing a lot of education on things like label reading, meal preparation, maybe finding new recipes or finding new packaged foods that they can purchase, things like that. So a lot of education. Working on behavior change strategies. So how can they, incorporate these changes into their life? So that can be really challenging. I listed a couple of resources on the page here. I think so much with working with patients with food allergies is really supporting them and providing lots of ideas and education. And you can also, I think, learn a lot from hearing from other people who have experienced food allergies. If that's not something you've experienced, I think it can be really valuable to hear how people have managed it and get ideas that way that you can help share with your patients as well. So then, of course, we'd love to prevent food allergies in the first place. So what are some things we can do to prevent or help prevent food allergies in children? Well, as with many areas, research is not definitive. We don't know absolutely for sure, but really it's recommended for a variety of reasons to exclusively breastfeed for 4 to 6 months of age. Again, there's a variety of reasons for that recommendation, but prevention of food allergies is one. Children who have been breastfed for a longer time have fewer food allergies. So certainly that is something to recommend. It doesn't mean that if a mom breastfeeds, that it's an absolute certainty that her child isn't going to develop food allergies, but it does decrease the risk. There kind of have been some recent changes in recommendations. Including sort of when to introduce potential allergens. So for a while it was felt that anything that was potentially allergenic, like wheat, eggs, nut, peanut butter, things like that should be waited for, we should wait for a long time to introduce them, and that would decrease the risk of food allergies. It is now felt that those foods can and should be introduced as soon as they're developmentally ready for those foods. So that's the current thought. And the idea being that the immune system at a young age is stimulated to recognize those foods as normal, as foreign but friendly, and not elicit an immune response. Again, this research has really gone back and forth in recent years, so I would say stay tuned in terms of those recommendations. So just in summary, some of the key concepts I'd like you to be familiar with or kind of take away is the difference between a food allergy and a food intolerance. Then thinking in terms of the immune system, what is a normal immune response versus what we might consider a false alarm? So when the immune response is stimulated from something that shouldn't stimulate an immune response, like normal foods. I also want you to realize that we have to use some caution with those diagnostic tests. They are not 100% accurate. So we need to use them as one piece of information, but also really help the patient work through what sorts of symptoms they have with what foods. Again, relying heavily on those symptoms when you're assessing patients. Food logs and food journals can be really helpful for that. Patients who do have food allergies need a lot of education and support with eliminating foods, particularly if they have a lot of allergies. It's not an easy way to have to live. So they really need both the education and the support. And then this certainly is an active area of research. So stay tuned with that.